So our next speaker is Dr. Chandrakant Shah, who is a Canadian doctor, researcher, and social activist. Dr. Shah is the clinical coordinator of Anishinaabe Health Toronto, where he has been a staff physician since 1996, providing primary health care to Toronto's Aboriginal community, as well as people who have been marginalized, such as the homeless, the unemployed, and children living in poverty. He is also a consultant with Peel Public Health, honorary staff at the Hospital for Sick Kids, and courtesy staff at the St. Michael's Hospital in Toronto. He is Professor Emeritus of the Dalla Lana School of Public Health at the School of Medicine, University of Toronto. Dr. Shah's textbook, Public Health and Preventative Medicine in Canada, is widely used by Canadian undergraduate and graduate students from a range of health disciplines. He is a recipient of several awards, including the Order of Ontario and the Outstanding Physician of Ontario Award 2007 by the Council of the College of Physicians and Surgeons of Ontario, which was given for excellence and for coming closest to meeting society's vision of an ideal physician. Thank you, Dr. Shah, for being here.
Thank you for your introduction. If I have to introduce myself, this is how I introduce. Dr. Shah is an old man. He's in departure lounge. I'm being 80, so I'm waiting for going up. And the third thing I say, he still have a lot of fire in his belly. That's why he's standing here. Okay. I thought we can start the slides. The first slide. No slide? That's okay. Second. Oh, there is here.
Yeah, so you just do the green button.
Just the green button? Okay. Okay. My three colleagues before me did excellent job, really, in terms of laying the groundwork for me. So I will not have to say so many things, or I can go back to what they've been saying. What happens in this kind of work, in this kind of conferences and so forth, we all get enthused. And we want to do this, we want to do that, and so forth. And then when we go home, many of us are in different kind of jobs. We are not academic, you are not social activists, you are not these. What can I do? And people feel hopeless and helpless in this kind of situation. So what I thought that I'll try to kind of give you my perspective and what can you do as an individual at different levels or collective levels or so forth. So the next, what all of these speakers earlier almost said this, and that is the fundamental thing in health is health. We look at biological or technological concept. It is not a biological, technological process. Health is a political. And unless you understand that, means, for example, gay people, okay? At one time, homosexuality was considered to be a disease. And now we don't consider that as a disease. Suddenly what happened? They are the same people. Okay? So it's a process in terms of the political process. A lot of things we do, and whether there was refugee care or indigenous care or so forth, that's where we have to understand that health is a political process. We define who is sick, who needs what, why does one need what, and so forth. So if you don't understand that part, you're lost in terms of the advocacy area. The second is, again, many of us are settled with this saying, but I am just a nurse, or I'm just a doctor working in a clinic or something, or I am a social worker or whatever you are in your work, or I'm a teacher. And people feel kind of, again, helpless and hopeless. And I kind of tell them that look at me, and well, you will see some of the examples as I'll go on. And I say, look at me, I'm vertically challenged, correct? I'm first generation immigrant who don't speak good English even. I'm brown, I'm sorry, so I say that also, I have no qualms about it. However, I have never felt important about getting things done, okay? Because you have to have a commitment and fire in your belly, otherwise nothing will happen. And so that's where each one of us come and try to do what best we can do. So don't worry about whether you are alone or you're in group. It's a small group of people. And here, each one of us, you heard about them, they are the small group of people who try to do something real large. And to understand this, I thought this is a good model. I wish I would have discovered way back earlier when I was learning and so forth, so I thought I would put it up here. And there are 5 stages of the social problem, if you want to get it moving forward. First is emergence, so the problem does exist even, people to have to recognize. Like racism, which Dr. Smiley talked about, that we Canadians are very smug about, and we think we are not racist, it's the USA. That's how we do that all the time. Once you recognize that emergence of problem happens, it has to be legitimized. So it becomes on lexicon of a lot of people and say, oh my gosh, we have a problem. So once you legitimize, then you got to mobilize the large group of people, because as I told you, health is a political construct. So whatever field you're moving into that, you have to make sure that you have a group of people moving with you. Map was very nicely presented and showed that how that large group of people came at the aid of the refugee health when this legislation was having. And then you have to have a plan of action. So it's okay to mobilize, like in one of the movement in USA, I think failed was the senior moment, forgot about this mobilizing about Wall Street occupation and so forth. While they had a great idea, it didn't move forward to the extent it should have, because they did not have a plan of action. So you got to make sure there is a plan of action, and then finally in that whole area is how it gets implemented, and not just implemented, but somebody monitors. So I'm going to walk you through different aspects. Each one of us can contribute at different levels of the step. Some of us are able to contribute in all 5 steps, you are lucky, but would take 3, 5 to 15 years to get that stage moving forward. So if you are impatient type, and if you want to look at move from one to another project, don't get into it. It is a long, arduous process really. So what I thought that I'll take you the example of unemployment and health. In 1992, I was in Iceland, and economy was booming in Iceland, but there was some recession at that particular time, and unemployment rate was 4.2% in Iceland, and everybody was complaining about it. And I knew about unemployment rate in Canada. Historically, we had always 6%. US would be always 5%, but we always had about 6% unemployment. And I said, what these people are complaining about? At that time, and then I come back home, and I realized in Canada we had 12.5% unemployment at that point in time. So that's the kind of, suddenly I woke up to myself and I say, yes, the unemployment exists. It has a lot of issues, including health impact. So as in health, I said I should help to move the cause forward. I'm not going to create employment, but at least I should help people to mobilize and showed the different dimensions of the health related to unemployment. So as usual, I was a professor, so what did I do? Go and review the literature and try to figure out that there was a lot of things written about impact of unemployment and health. So that was easy. So that's health impact. I could see that. I could see some of the social impact. However, I wanted to move forward because just going and saying health, unemployment has mental health impact, has a chronic disease impact, lifestyle impact, wouldn't do good enough to me. So what I did is that I decided that I'm going to look at the economic impact, because that's what the politician understand. If health is a political construct, that's what people understand. So we looked at the literature and we not manipulated, but we kind of understood the literature and tried to develop that how much excess utilization would be done because of the unemployment. And we went on different levels of unemployment, at that time was 12.5%, and look at what excess cost would be in different spheres. And so that's the first one. It's a fancy way, but it was a solid piece of research. So you want to make sure that when you're developing evidence, people can't find a hole in your evidence. Okay, so that was the kind of way we went around, and then we looked at the extra cost in terms of the hospitals, admission to inpatient, prescription drugs, and all kinds of things. And what we came out, and to our surprise, that unemployment, excess unemployment over our historical 6% was somewhere about $850 million to $1.2 billion. And that's a good thing to do. So the next thing what we did is mobilized. Now, because remember the emergence of problem, legitimization, and the mobilization, both I needed to get it done. So what we did, in essence, there was a big meeting of the Association of the local Ontario public health physician. Usually it's sleepy meetings, excuse my expression. I hope I'm not hurting anybody's feeling, because I have trained, at that time, 70% of the local medical officer of health were trained by me, so I had to take that blame if there was a sleepy meeting generally. But it was in Sheraton, and I realized I kind of got invited myself. And I said, I have something very interesting, public health should get involved. And being their ex-professor and director of their ex-program, they invited me anyhow. And I was the keynote speaker. Usually media never came to that meeting. So I called up Toronto Star and I said, you might be interested. I've got something very interesting to present. And I had a good relationship with media anyhow. So I got them there and I put this whole economic impact of unemployment. And suddenly it was a frontline story, it was in radio. Suddenly once Toronto Star put out, was on the radio. I got that afternoon phone call from the Minister of Health's office and say, could we have your report? Because somebody asked in a question answer period about this whole thing and so forth. So suddenly it was on public agenda that this health, the unemployment is not only on social grounds, hurting or economic ground, it's also in health, and it's increasing a lot of cost of healthcare. So that was at one level we did it. I made sure that also we as a professional knew what impact it has on health. So I was fortunate that Ontario Medical Association, I was working with them on this one. And then we got chiropractic association, psychological association, all kinds of association who deal with health and patient, got them in one room, which was never happened before, particularly chiropractor and Ontario Medical, they never see them together. They were all together. We presented and we got some commitment from each of these associations, how they would warn their member what to look for and so forth, and how to help their unemployed clientele. The third thing we did is this is a public health issue. So we got into also Canadian Public Health Association and put this as one of the position paper there. and that got debated, and a resolution was done and passed. What happened in the process also, there were a lot of media were there. And so I was interviewed in my hotel room in Halifax, I still remember, for 3 hours. Every 10 minutes from one end of the country to another end. 12 interviews I gave on radio, CBC, from one end of the country to another end of the country. So this was kind of mobilization process and so forth. So what I'm trying to again say that I may not be able to reduce the unemployment, but here I was giving a different dimensions to the unemployment. That's okay. So that's my contribution in that sense of that the providing mobilization, providing the evidence, and moving forward the issue. The next one, I thought I would. There are a lot of things in Aboriginal health I've done, but one I thought that would we very quickly talk about is the last one, which is the citizenship initiative. And this was in 1987, and this was just only as an individual what I was there. Other one was a lot of mobilization, a lot of help and so forth. Here, in 1987, my wife was taking a citizenship exam, and I suddenly looked the booklets, what she had to study for exam, and one of them was about our parliamentary system, second one was some glossy thing, and topographic map on one side, another side, 3 sentences for Aboriginal people on that particular thing. And the one was that the Aboriginal people were here before the settler came. Number 2 was that they grew corn, tobacco, and squash. Number 3 is, the third sentence was that they built canoe and snowshoes, and fourth sentence was added by me, and we lived happily ever after that. So that was the situation. I realized it really bogged me, and I started writing campaign and did a lot of writing campaign single-handedly to all kinds of organization and all kinds of the people in power and oppositions and so forth, and they all kept writing a letter to the Minister of Citizenship and saying this needs to be changed. I had also said that there has to be questioned, because as a professor I knew that the tail wags the dog. So people don't study unless there is something in that kind of, if you put question, people would just bypass it. And that finally got changed, and the citizenship examination booklet in 1994 got changed. They have a 1.5 page on Aboriginal, at least a little more than they ever had before. There are questions on citizenship examination, and I'm happy to say that 2.4 million Canadians since 1994 know little more about Aboriginal people than they ever knew before, really. And that's one person, I'm just going to say to you. And so don't despair. You can do yourself, you can mobilize, you can collect the evidence, you can help in this direction. So there are a number of venues where you and I can be a useful citizen. Thank you.